everybody. Welcome back again to the Westside Nut Club Fall Festival, live on West Franklin Street in Evansville for Local Lifestyles today. We're so glad that you've stayed with us. We're so glad that our friend Merritt Bates Thomas has joined us down here at the festival. And you've been kind of hanging out through our whole show, so thank you for sticking around.
It's good to be here and get the experience.
Yeah. It's fun, isn't it?
It is.
It's tons
very
of energy.
festive.
So obviously, you know, this is kicked off here the first week in October. October is Breast Cancer Awareness Month. We all kind of know that by now, but it's just such a great month to remind ourselves of so many things and bring awareness once again to breast cancer. So Green River Health Department, District Health Department, what are you guys doing this month?
So this month, throughout the year, we have a special grant called the Pink Grant. We create awareness around those annual screenings women need to be mindful of, in particular mammograms, and assuring local access in our rural counties. In partnership with the Kentucky Cancer Program, creating that awareness. 1 in 8 women will have breast cancer in their lifetime, and it's the #1 cancer impacting Kentucky women.
Yeah, and that's just, those numbers are incredible every single time that we hear them, and we hear them year after year. We hear them a lot in the month of October, and you mentioned the annual screening, so let's kind of remind everyone what those recommendations are and why they're so important.
Right. So I think it's important to remember many people hear mammogram and they think, oh, I'm not old enough for that yet.
Yeah.
Traditionally, women ages 50 and older are at greater risk for breast cancer, but the mammogram screening starts usually around age 40 unless there's a family history.
Like you said, we don't think we're old enough, or we get to that point a lot quicker than we think we're going to, and all of a sudden it's here, and it is something that we need to do, and probably the best way is to make sure we just schedule that every year and not miss those appointments.
Not miss those appointments, but getting back to a much earlier age, doing that monthly or twice monthly self-breast exam so that you are familiar with any changes that might be occurring, having important conversations with your healthcare provider. If you don't have a healthcare provider, notice a change, seek out medical attention so you can get the appropriate care that you need and rule out whether or not it is actually cancer or not.
And don't worry if you think, oh, this might not be something, just go have it checked no matter what. Like you said, if you notice anything different or anything that does seem different or a change to you, seek out some help. And we talked about the age of 40. That's when women should start having their annual mammograms, but it could be earlier. What are kind of the risk factors involved maybe, and you want to kind of start doing that at an earlier age?
So risk factors are the things we can't change. Being a woman puts us at greater risk. Age 50 and older, the older we get, although more and more you hear of younger cases being diagnosed.
I feel like we are too.
And we tend to focus on women, but men can be impacted by breast cancer as well, and we shouldn't overlook that. And the fact that men need to be mindful of checking for any changes as well.
And that's probably one that we really need to talk about even more, so that becomes just more of a normal thing.
Exactly,
and, think about that.
The family history.
Yeah, that's huge, right?
So knowing that, being mindful of that, because a screening could be recommended earlier.
That's right, and that's when you kind of really need to be in touch with that with your doctor, or if you do, you know, or find a doctor at that point. If you have the family history, it could certainly be earlier. What are some things that we can all do with just our lifestyle to just try to prevent this from happening? There are some things we can't change, but there are things that we can do too.
Exactly. Prevention is key, and the nice thing about the prevention is it covers a lot of things. So don't smoke. And if you are smoking, it's a great time to consider stopping. Eat a healthy diet, plenty of whole grains, fruits, vegetables, lean proteins, lower in fat, physical activity. Just leading a healthy, active lifestyle is so important. And taking care of those annual screenings is key too. Just having that conversation with your healthcare provider and doing like a checkup annually.
Perfect. Thank you, Merritt, so much for being down here today. You always have wonderful information for us, and we will look forward to seeing you again soon.
Thank you.
Of course.